Welcome to You're in Good Hands, the podcast where we dive into everything urology, leading-edge treatments, education on a variety of topics, and expert insights to keep you informed and healthy. Brought to you by the Advanced Urology Institute of Georgia, where innovation meets compassionate care. Because when it comes to your health, you're always in good hands. As always, the information discussed today is purely informative and does not constitute medical advice.
Welcome back to the deep dive. Today we are getting into a really powerful imaging tool with a bit of an intimidating name: fluorodeoxyglucose, positron emission tomography, and computed tomography.
Right.
It's a technology that's really becoming essential for guiding treatment in some complex urologic cancers. We're talking bladder, kidney, and testicles.
It is. It is a very advanced test. And our mission today, really, with a lot of great information from the experts at Advanced Urology Institute of Georgia, is to clarify what this is. And maybe more importantly, why your doctor might recommend it for these really critical decisions like staging cancer or seeing how a treatment is working.
And we should just say, we're talking about the PUT scan.
Yes, just PUT.
That name PDCT kind of tells you what it is. So, okay, let's unpack this. We know the CT part gives us the structural pictures, the anatomy.
Right.
But what is the PT part bringing to the party?
The PT side gives us the metabolic detail. So it's about how the tissues are functioning, not just what they look like. And the key is this radioactive tracer, fluorodeoxyglucose, or FDG. You can really just think of it as a special kind of sugar that's injected into your vein.
A sugar. So why are we tracking sugar? What makes that so important for, for oncology?
This is where it gets really fascinating. A lot of cancer cells, because they're growing and dividing so fast, are, well, they're metabolic hogs. They use a ton of energy, and specifically, way more glucose, more sugar than your normal healthy cells. So when that FDG tracer is floating around, those active cancer cells just gobble it up.
And then they light up on the scan.
They light up like neon signs. They show up as these bright spots.
That visibility must be a total game changer. So we understand it's mainly used for staging, right? To see if the cancer has, escaped the original spot.
Exactly.
Has it spread to lymph nodes or the lungs or bones? Because that dictates everything.
It does. It answers the huge question. Do you need surgery to remove one thing, or do you need a systemic treatment like chemotherapy to treat the whole body? That whole body picture is just invaluable.
It sounds like a silver bullet, but I'm guessing it has limitations. For these urologic cancers, what are some of the nuances the care team has to think about?
That's a crucial question. For bladder cancer, for example, the PET-CT is fantastic for finding spread outside the bladder.
Okay.
But seeing cancer in the bladder wall itself is actually pretty tough.
Why is that?
Because the tracer is cleared out through the urine. So it naturally collects in your bladder before you expel it, and this makes the whole bladder just look brightly lit up. It can obscure the actual tumor.
It hides the target. And for kidney cancer, I know doctors often start with a CT or an MRI.
That's right. It's not usually the first tool for diagnosing the kidney mass itself. But if spread is suspected, or if we're monitoring a treatment like immunotherapy to see how it's working, then the PET scan is outstanding for tracking those other sites of active disease.
And for testicular cancer, I've heard it's key after chemotherapy.
Exactly. After aggressive chemo, say for a type like seminoma, you might have a residual mass left. A lump, yeah. And the PET scan helps your team figure out, is that still active cancer that needs more treatment, or is it just harmless, inactive scar tissue? Two very different paths forward.
Let's walk the listener through the practical side. If your doctor recommends this, what's the prep like?
Prep is so important for a clear image. You have to fast for several hours beforehand.
Right.
The idea is to starve your body's cells a bit so the cancer cells are extra hungry for that sugar tracer. You also need to avoid heavy exercise and sugary foods the day before.
And the day of the scan itself?
It's pretty straightforward. The tracer goes in through a small IV, then you just rest quietly for about an hour while it circulates through your body.
And the scan?
The scan itself is fast, maybe 20, 30 minutes. Your only job is just to lie very, very still. And here's a vital point on interpretation. Not every bright spot is cancer.
Right.
An infection or just simple inflammation can also light up. And there's a low to moderate radiation dose.
So it's not a standalone answer?
Never. The clinical team always interprets these images alongside your lab work, your symptoms, your history, All of it together creates the treatment roadmap.
That really is the major benefit then. It's whole body information all in one study to help make these incredibly personalized decisions.
Exactly. And while the scan is just a snapshot in time, it's good to remember that your own choices, not smoking, staying active, they support the treatments that the scan helps to guide.
Stay engaged.
Stay engaged and always ask your care team questions. That's crucial.
And if you do have questions about whether advanced imaging like a PET scan is right for you, the experts at Advanced Urology of Georgia are available to guide you through those testing and treatment decisions. They see patients in both Snellville and Sandy Springs, Georgia. We hope this deep dive helped clear things up.
If you happen to be in Georgia, you can always check out Advanced Urology Institute of Georgia. They've got 10 convenient locations throughout Metro Atlanta. You can make an appointment by calling 678-344-8900 or go online to www.advancedurology.com.
Great advice.